So now we're going to use a little bit of cupping. Now remember, the reason we're using the cupping is to address any of the fascial restrictions. So we did some soft tissue work, a little bit of passive release technique. That was to get the tension out as much of those muscles as we can. Now we're obviously going to address the myofascial restrictions if there are any there. So you need to use the appropriate size cup. Obviously for reasons, we're going to be using this one because given Ali's forearm, we're probably going to be able to cover that quite well. All right, so simply being, all we're doing here is working along the length of the extensors. That's all we're doing. We're going to come along and back and work up there. So depending on how tight they are will depend on how much suction that you need, remember. Okay, so the contraindication for this is obviously maybe increasing the suction too much, and then it'll actually give a bit of a burning effect, and we don't want that burning effect. Okay, so just enough that it's tolerably quite comfortable and it's not necessarily sharp and painful. Okay, so we're working along the length of these extensors all the way down. Just watch that obviously you've got the ulnar condyle there, so you don't want to run into that. We come all the way up towards the musculotendinous junction, across. Now we're going to bang sort of right nudge in towards that brachioradialis and then down the bulk of these extensors. Okay, now you can put the wrist in a bit of extension as well, once again, which I like to do. So it just means that you increase the tension a little bit more on that fascia. Okay, so you can spend anywhere, once again, as I said before, anywhere from 2 to 3, maybe 4, depending on how restricted they are. Remember not to lose contact or neglect this area right out here where the extensor carpi ulnaris is. It's very, very important. As I said, I find it's a very big culprit, and we're going to address that area in a minute with some needling.